Hello, and welcome to Easy Talk English, the podcast where you learn real English through simple, natural conversations. If you want to improve your listening, speaking, and, well, your daily English, you are definitely in the right place. I'm Emma.
And I'm Jack. Let's start today's conversation.
So, hi, Jack. You don't look very energetic today. Are you feeling okay?
Honestly, not really. I have a bit of a headache and my throat is really sore.
Oh, no, that sounds so uncomfortable. Did you go to the doctor?
Not yet. I was hoping it would just kind of get better by itself, you know?
Right, yeah, so many people think like that. I do it too, but sometimes it really is better to see a doctor early.
That's true, so I guess today's topic is pretty useful then.
Yes, perfect timing. Today we're talking all about going to the doctor. So let's start with the very first step, making an appointment. How do you usually book a doctor's visit, Jack?
I usually just call the clinic, or if they have one, I'll use an online booking system. It's nice because I can just pick a date and time that fits my schedule without having to talk to anyone.
Same here. The online systems are the best, but sometimes it's so hard to get an appointment on the same day, isn't it?
Oh, for sure. Especially when it's like flu season and everyone is sick. You call up and they're like, we can see you next Tuesday.
Exactly. So when you do call the clinic, what do you usually say?
I try to keep it simple. I'll just say something like, hello, I'd like to make an appointment with the doctor. And then they usually ask for my name and, what the problem is.
Yep, that's simple and clear. Perfect. Okay, so you have your appointment. When you arrive at the clinic, what's the first thing you do?
I go right to the reception desk and check in. I'll just say, hi, I have an appointment at 10 o'clock or whatever the time is.
And then you usually have to wait in the waiting room, the dreaded waiting room.
Yes, sometimes you're lucky and the waiting time is short, and sometimes it's just very, very long.
Waiting rooms can be so boring and sometimes really noisy, especially if there are a lot of kids.
Totally. Okay, so after the waiting, you finally see the doctor. Let's talk about symptoms. What do doctors usually ask first?
Yeah, they'll usually start with something pretty general, like what seems to be the problem, or what brings you here today.
And how do you answer that? What do you say?
Well, I just explained my symptoms. So for you today, you'd say, I have a headache, or for me, maybe I feel dizzy.
Right. Other common symptoms are things like a fever, a cough, stomach pain.
Or back pain. Yeah, it's really important to describe how you feel as clearly as you can.
Mm-hmm. And doctors also ask follow-up questions like, how long have you felt this way?
Right, or is the pain strong or mild? That kind of thing.
Exactly. Now let's talk about the examination itself. After you've described your symptoms, the doctor might check your temperature, your blood pressure, or listen to your heartbeat.
Yeah, sometimes they'll ask you to open your mouth and say, ah, or to breathe deeply.
It can feel a little uncomfortable or awkward, but it's totally normal. They're just gathering information.
Right, so after the examination, the doctor gives you some advice. They might say something simple like, you need more rest or drink more water.
Or they might prescribe medicine.
Yes, and if that happens, you then have to go to the pharmacy to get your medicine. So be honest, do you always follow the doctor's instructions?
I try to. I really do. It's so easy to start feeling better and then just stop taking the medicine.
Oh, yeah, but that's usually not a good idea. You should always finish the full course of medicine.
Definitely. So, how about we do a short example conversation? A little role play.
Okay, sounds good. You be the patient, since you're the one not feeling well today. I'll be the doctor.
All right. Good morning, doctor.
Good morning. So, what seems to be the problem?
I have a really sore throat and I think I have a high fever.
Okay, and how long have you had these symptoms?
For about 3 days now.
I see. Okay, well, let me take a look. Yes, I'm going to give you a prescription for some medicine, and I'd recommend you get plenty of rest for the next few days.
Okay, will do. Thank you, doctor. Hey, that was pretty realistic and useful.
Thanks. Now, let's quickly talk about emergency situations because that's a bit different. If something really serious happens, you shouldn't make an appointment. You should go straight to the emergency room. That was a great role play. It covered the basics of a typical doctor's visit. But what if your problem is more specific? Sometimes you need to see a specialist.
Yes. For example, if you have severe pain, like you can't stand it, or serious breathing problems, or heavy bleeding. A specialist. What do you mean by that? Isn't a doctor just a doctor?
Exactly. In those cases, don't wait. Just go. Well, not exactly. A general practitioner, or GP, is your main doctor for most health issues, but for specific problems, they might refer you to a specialist. For example, if you have a skin problem, you would see a dermatologist. For heart problems, you'd see a cardiologist.
For sure. Okay, so before we wrap up, let's do a quick language recap of the key words we used. Oh, that makes a lot of sense. So your GP is kind of like your first point of contact, who can then direct you to the right expert if needed.
Good idea. First up, appointment. An appointment just means a planned visit to the doctor at a specific time. Exactly. And speaking of being proactive, we should also talk about preventative care, like annual checkups.
Next, symptoms. Symptoms are the signs that you are sick, like a cough or a fever.
How about waiting room? That's the room where you, well, sit and wait before seeing the doctor.
Okay, two more. Prescription. A prescription is the paper, or these days, the digital order from your doctor for medicine.
And last one, pharmacy. That one's easy. It's the store where you buy the medicine from the prescription.
Perfect. And before we finish, here is one last super important tip.
Ooh, what is it?
Always tell the doctor the truth about your symptoms. Don't hide anything because you're embarrassed. And also, don't be afraid to ask questions if you don't understand something.
That is such good advice. Your health is what's most important. So I think now is time to end today's episode.
That's the end of today's episode. Thank you so much for listening to Easy Talk English.
If you enjoyed this conversation, please don't forget to like, subscribe, and maybe share this podcast with your friends.
Practice your English every day, even if it's just a little bit. It really does help. And we'll see you in the next episode.
Goodbye, everyone.
Bye.